The Center for Global Health has places around the world where we send students and faculty to do educational and research projects. One of our major partners is in Uganda at Makerere University and the Infectious Disease Institute, which is affiliated with Makerere. We've worked there with the public health school and with the medical school for many years and have a variety of programs going on. We even actually have an adjunct faculty, Dr. Seppi Mary, who's an infectious disease doctor who trained with me in the late 90s, who plays a major role at the Infectious Disease Institute, primarily in clinical pharmacology, HIV drugs and how they work and what drug interactions are important and so forth. It's a very big field.
Which is all about dosing drugs. But I began to wonder, if you look at the dose of HIV drugs, all of the doses are decided usually on 70 kilogram men, because that's where the studies are done in the US in particular. But you know, that might not be the dose for a 40 kilogram woman who's pregnant, who has malaria, who has worms. So I began to wonder if the doses needed to be tweaked. And also, as an example, you know, some of these patients, if they have malaria and you have to treat their malaria, the drugs can affect each other. And we found that the number one drug for malaria that's used throughout the world, if you give it to somebody with TB, it doesn't work because the drugs counteract each other. So the TB drug works and the malaria drug doesn't. We did that study here, and it actually got to the level of the FDA, and they changed the label, which I think is amazing because most people think you can't do quality research in Africa that will reach FDA standards, but we did, and that's made a big difference to patients all over the world. It sounds like a crazy story, but the truth is I was at a HIV conference in Paris, and Nelson Mandela came in, and he kind of hobbled onto the stage like an old man, but then he stood up and he was this giant, and he said, "You have failed to bring your research and your medicines to the communities that most need them in the most vulnerable parts of the world."
One of my junior faculty, Kim Scarcy, who's a pharmacologist, right now has a very important grant studying the interaction of implanted progesterone devices, which is a little implant put under the skin that is a form of birth control.
In the US and in many developed countries, the predominance of HIV infection occurs in men. And I've always felt that there's a lot of gender questions, questions surrounding treating women with HIV that were hard to answer in the US, and we just really didn't have answers for. So, for example, in sub-Saharan Africa, of patients who are HIV infected, 58% of those patients are women. So the effect of the therapies that we're giving them for HIV is very important when it comes to gender-specific considerations like birth control. The specific problem is that we know that some of the therapies we use for treating HIV can perhaps decrease the effectiveness of birth control. And by that I mean it's possible that women who are on antiretroviral therapy or treatment for HIV may have a higher risk of pregnancy when they're receiving birth control because of negative drug interactions between the two therapies.
Dr. Mohammed Lamord is actually a Nigerian who has been working at the Infectious Disease Institute for quite some time now. And he is an essential and critical member of the research staff in the pharmacology department.
Well, Northwestern really helped me at the early stages of my career. So I came to Uganda really to get training as a clinical pharmacologist. And the areas that I was focusing on had to do with HIV, TB, and malaria. Now, Northwestern established a project that helped me complete my PhD thesis. And that project helped to understand how HIV treatment during pregnancy is influenced by pregnancy itself, and whether we need to change the doses we give to pregnant women when they're on HIV treatment. So the Infectious Disease Institute looks at a wide range of infectious diseases, but I think because the challenge of HIV in Uganda was so severe, it initially focused primarily on HIV treatment, care and research, and also training of health workers in the management of HIV. So it has both a capacity building angle where it helps to build the resources that are necessary to confront the HIV challenge, but then it also manages over 10,000 patients who have HIV and attend the clinics every day.
We have 2 students that are in Uganda working at Makerere on projects, and they stay there for approximately 4 weeks, and they go out and work with the Ugandan students and do their project over the month. They get supervised. There's a whole international office there that helps them, and the faculty has been very, very supportive. These projects are really invaluable.
I'm doing a project on how providers feel that Uganda's policy on male medical circumcision has been implemented, and what they've had trouble with and what they've found successful. I think it's really great to see how Uganda is trying to provide health care for as many people as possible with their very limited resources. So I'm really impressed with the hospital system here, even though it's very different than Northwestern's. It's amazing what they're able to do with the resources that they have.
Oh, one of my friends who's rising 3rd year had done this last year, and when I heard about his experience and all that he'd seen, it was breathtaking. So just to see how medicine works in a different area, and being exposed to different diseases and different pathology and just different people and cultures in general was very interesting to me, and just to see how culture and medicine collide and what that looks like, and how they are able to utilize their resources here in a very effective way actually is wonderful.
In addition to doing the research there, and the results could have actually implications worldwide, what happens at the Infectious Disease Institute and the projects that we're doing is we're helping with the overall infrastructure in Uganda itself, in the medical system there itself. In the process of doing these projects, we work very closely with the Ugandan staff, the nurses, the doctors, even the heads of the clinic, and our projects there are actually their projects. And we all work on these things together, and we increase the overall scientific capacity for the Ugandans as well.